Good afternoon and welcome to Webinar Wednesday. We're excited to have over 350 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday lunch bag for answering this trivia question. Today's sponsor, CyberMDX, is headquartered in New York. Which river does the Brooklyn Bridge span? Answer now using the questions feature on your dashboard. While you're answering, I want to invite everyone to join us for our Spring MD Expo, which will bring HT professionals from across the nation to the Marriott Hotel and Convention Center in Houston, Texas, from April the 11th to the 13th. Join us for 3 days of learning, networking, and the latest advances in technology, products, and services. Registration is now open. Register for free using the promo code 19MDE Houston, Houston. More details can be found at mdexposhow.com. Okay, and let's see who the winner of our Webinar Wednesday lunch bag is. And it is Ed Bicon. Congratulations. The correct answer is the Hudson. Webinar Wednesday would like to thank our sponsor, CyberMDX. CyberMDX is a pioneer in medical cybersecurity with an IOMT solution that delivers visibility and threat prevention for medical devices and clinical assets. The solution identifies, categorizes, and protects connected medical devices to help ensure their resiliency as well as patient and data safety. With CyberMDX, hospitals identify, assess, detect, and prevent potential cyber attacks with continuous discovery of medical devices, comprehensive risk assessment, and owl-based containment and response. For more information, visit cybermdx.com. Our presenter today is Safi Oranski, Vice President of Business Development at CyberMDX. Safi, you may begin whenever you're ready.
Thank you very much, Linda, and thank you everyone that is joining us this afternoon or morning time, wherever you are. So as Linda mentioned, I run business development for CyberMDX, and what I'm going to cover with you today in this guide to MedTech security are a couple of areas in the agenda or the topics I want to cover. We'll start from, cybersecurity kind of in a big picture, drill down more into healthcare and the impacts of that. We'll talk about some of the risks and implications related to IOMT or MedTech, what we see in the current landscape, and then work through some kind of a best practice, how to address some of these things. It could be sometimes looks overwhelming, but what are the best practices that we see today? Hopefully you can get something actionable out of today's webinar. So let's jump into this. I want to start with a little bit of a global scope of what happened last year and how this is affecting us moving forward. So from attacks like the speculative execution attacks, the Spectre and Meltdown, which basically attacks anything from smartphone to data centers. These general attacks can hit hospitals as any other systems, and they can happen anytime. And we're probably in the near future, as more devices come on and more computing power, we'll see more of these. Ransomware, this was a big attack around ransom especially for healthcare. Samsung Group was the famous one, but definitely, in the healthcare area, we're gonna keep seeing these attacks more. Although last year, because of cryptojacking, which is basically a worm malware that's using CPU power for mining, so we see how attackers have been using cryptojacking just because this is more economical. Continuing, we saw the Facebook, Cambridge Analytica privacy issues, and that goes back to HIPAA and other types of compliances that we keep on seeing with regards to what's really important? Do the people that are under 30 think about privacy the same as people that are over 30, and so on? We'll keep seeing more debate on that, specifically the GDPR, which kicked in last year and is now in kind of starting to get into full force, and that has also implications on things we do in healthcare and outside healthcare. Artificial intelligence, a new area. If you read what's going on, this is going to become bigger and bigger, and it both has good implications for healthcare, for what you guys do on a day-to-day basis, but also has big implications in terms of cyber. There's a whole webinar we can run around that. But what I kind of want to stress, and will stress maybe a little bit more, we're opening up the whole threat arena with artificial intelligence. So I expect more and more news around that. And like I said, we'll see it coming through the year. Marriott, the big 500 million exposed personal information that came out of the Marriott saga, going back into where privacy stands, what type of information we share, and what should not be, out there, for attackers to look for. And then lastly, becoming, and it's not a new threat, but becoming a bigger one in the last couple of months, nation-state attacks, specifically China and Iran. The politics that are going around us, they're affecting us in many, many ways. Specifically, like I said, more attacks coming in from China and Iran recently, specifically attacking US organizations, and hospitals are definitely in that mix. So, we think that we're going to see more of these coming forward, and we need to be prepared. So having, looking at all these common themes, I want to kind of touch now how these aspects affect our world or your world in healthcare, or specifically healthcare IT, and what are the challenges we're seeing. So the first one is the shortage in talent, and that's not new, and it's going to be with us, and according to surveys, it's going to actually get worse, which means, in healthcare, we're going to be relying more on third-party providers. We're going to rely more on software and hardware and technology in general in order to help us protect against cyber threats. The other one is the regulation and compliance. There's good intentions, both on the FDI, OCR, and all the bodies that are in charge of this. What we find, as a challenge here is if you think of even the pre and post market of the FDI, there's a big difference between what we're trying to do, or what the FDA is trying to do in the pre-market, and what's going on after the device or something is implemented within the IT environment. And therefore, once again, the kind of common challenge between technology and compliance and regulation, where one is a rear view, and one is basically happening in real time, changing from hour to hour, and how do we reconcile this? Our industry is going through a lot of M&A. Of course, there's a lot of innovation, but at the same time, and as more things come in, our visibility is not as good as it was before. We have a lot of devices. We don't see all of them, especially if you're acquiring the system or being acquired. You want to know what's going on the other side. You want to know that new threats, if new threats are around, what they are and how to protect yourself against them. And that's once again one of these trends that I think will increase, especially in the US in the coming years. Patching and vulnerability, big issue. I'll talk more about this a couple of times in this presentation, but there's no good solution today. I think there's this common interest of everyone to do it better, but at the end of the day, somewhere between 30 to 40% of devices are unpatched and systems, and creating a big vulnerability. As we said, more third parties are being used, especially in smaller hospital or healthcare organizations, whether it's for cyber or just other types of services, supply chain. They carry their own risks with them, and by that they're opening up a bigger surface of attack for that matter. Growing use of devices in general, right? Whether it's IoT, telehealth, connected and devices that are either coming into the hospital or hospitals are connecting with people staying and at home. This is a huge area, and this is a big part of what we're going to talk about today. But once again, a threat or a trend that's going to stay with us and even go larger in the next couple of years. And then, last one in this list is the whole cloud and people working remotely or communicating remotely with hospitals. Like I said, another area that we should be conscious about. So a lot of these challenges that are coming are actually the basis of this is this whole what we call MedTech, and MedTech is a big thing, but in basic explanation, we're talking about converging worlds in the healthcare industry. So anything from new biotech, medical devices, services, and of course information technology, all these things kind of coming together. If you put on top what I talked before, artificial intelligence, we can get amazing new treatments for patients, amazing new opportunities to identify sicknesses and diseases. But with that also come a new level of threats that need to be dealt with in the cybersecurity world. So that's what I said when I meant. What I meant when I said before AI is coming. I think it's going to be more and more prevalent in every aspect of our life. But when we talk about our industry in healthcare, this is the area where a lot of new things are going to happen. And we'll, like I said, we might hold a webinar just for this specific AI. As I mentioned before, all of this happening while cyber threats are growing. These are just numbers from last 2 years. Hospitals are being attacked more. They're better for attackers. There's a lot of financial gain, whether it's through ransoms, which is nearly 90% of attacks, or just getting the EMR. And then once again, one of the biggest issues with organizations is their unsecured medical device, and we see it here in these numbers. So with that said, I want to kind of jump into these new risks and implications, and I want to focus on patient safety because I think it's a point that's not stressed enough. But first of all, what do we mean when we say Internet of Medical Things? So it's basically anything that, I look at it as connected medical devices. The FDA has is basically in charge of that area, but everything that's connected to a patient at the end of the day is something we really care about. Then we have what we call the supporting, workflow supporting things, pneumatic systems, printers, but anything that supports the patient care process. And that's, once again, has a big impact on what is the basis goal of any healthcare organization. And then the last one is the ecosystem devices, the infrastructure that powers everything from workstations to terminal servers and so on. And I'm looking at this, and this is a very complicated kind of world, if you want. But really, what is a challenge, and I think things we should be thinking about more, is that every one of these devices is impacting a patient. Either it's connected directly or supports a patient's care process. And if you think about a patient in an ICU, it's connected to between 1 and 12 medical devices sometimes. And really what that patient cares about at that second, or what their family cares about, or something like that, is their safety, right? It's not just the privacy, or not the privacy at all. And a recent study from the University of California, their cyber team found that there has been somewhere between 100 and 1,000 cases where there were some adverse events that have been related to cybersecurity of IT infrastructure. So I do think that it's time to broaden the conversation, not just about privacy. We need to think about patient safety. We need to think about what type of plan do we put in place, and what program do we put in place, and is a program that's focused on HIPAA or compliance enough to protect patients and their safety. I believe it's not. I think there's a lot more we can do, and that's what we're going to talk about. But just before that, I want to share with you quickly here a clip of what our cyber research team is doing, and showing you how close this is to home.
How easy is it to hack into an infusion pump? In less than 20 hours, with fewer than 200 lines of code, we were easily able to hack into a syringe. The syringe is the industry's most popular brand. See the pump rate at 2.10. Infusion is started or stopped with a simple press of a button. Notice the aggregation of the total dosage. Even at a closer look, it is hard to notice the syringe's progress. Now let's get connected to the hospital. The syringe communicates using a serial port, which is not compatible with standard networks. A terminal server is required to bridge between the two. Let's connect everything together. A laptop with our malicious code will also be connected to the same network. It's hacking time. First, we broadcast a discovery signal through the entire network, which causes each of the terminal servers to respond and identify. That's how we get their IP. It's that simple. The terminal server supports connecting multiple devices. Here we scan its devices looking for our syringe pump model. Once the syringe is located, we open a communication channel. With it, we are able to send it remote commands. A hacker can control the syringe, instructing the pump to operate at a faster rate. This is happening with no physical interaction and no footprint of malicious activity. Alarms suddenly generated by the machine are also remotely muted. So simple, yet so horrifying. This illustrates how incorrectly connecting a medical device to your network can lead to devastating results. So how protected are your critical assets?
So just before going into our next section, I'm going to ask Linda to put a little poll for us, just so we can kind of understand where you guys at, with that regards. Linda, can you do it, please?
Yes, I've now launched it, Safi. The question is, has your organization experienced a cybersecurity incident during the past 12 months? Either yes or no. Okay, Safi, I can see lots of people are actually voting, so we'll just give it a couple more seconds before I close. Okay, 1, 2, 3. Okay, I'm going to close the poll now. And your answer, Safi, is 32% said yes and 68% said no.
Okay. No, that's good. That's great. That for the no guys, and I think it's exactly what we're saying, right? So we're starting to see more. What I believe, by the way, is that specifically with medical device, we just don't know or sometimes have a very good understanding if it's a cyber thing, but I do believe that it's happening more than we know. But with that said, let me kind of go with you. What is the current landscape that we're seeing today with medical device and healthcare organizations like yours? But I want to start with maybe the the explanation, and if it's not clear, but I think it's important to say why our medical device is so vulnerable and what makes this challenge unique, and I think to stay with us for a long time. So the basic problem of everything is visibility, right? You cannot protect what you don't see. And I see many organizations that if you ask them what is running right now on your network, I don't think they can tell us exactly, and definitely not have an ongoing assessment. It might be a picture of time with an audit that they've just made, but having this real time is critical. Like we want to see, everything else, like computers and laptops. So that's the first challenge here. Part of this challenge is that there's a large variety of devices and vendors and protocols and system versions and types. And even if you see some, you might not see others. And as you'll see in a second, some are, a lot of these devices are serial devices, are RS-232 devices that are sitting behind terminal servers. It's very, very hard to see them and very hard to identify them on your network. They're all using communication protocols. We've identified close to 100 different protocols. A lot of them from small companies, but still, they're on the network. Many of them, as I mentioned before, lacking patching or antivirus software. The controls that are in today, the firewalls or NACs types of systems like this, are not a good answer for this. They were not built for this. It's more for the perimeter in most cases. And even if they are there, they don't recognize medical devices, not to mention the types and operating systems sometimes that they run. And then lastly, because the way the healthcare organization is built, there's this kind of shared responsibility between clinical engineering, IT, IS, and the vendors. And once again, the line is very blurry where each one does what, especially with between, I see this between clinical engineering and IT. Not always the teams are working together. Sometimes they will have, a representative in each other teams, but in most cases, they don't work together enough in order to assure that, these devices are better secured. And the trends, by the way, are showing us that this is the case. So 300% rise in CVEs in the last 5 years, and 100% rise in the number of ICS cert advisories. And this is the reality, right? We've seen more and more threats coming in, and as I mentioned before, hackers are motivated by money and the ease of penetrating into systems. And like I said, the healthcare system is quite relatively easy to penetrate with the devices that are out there. A little bit about network segmentation. Basically, a lot of hospitals are using segmentation as their main tool to protect medical devices. It means that running medical devices on separate VLANs in an attempt to prevent attacks, but also if an attack is happening, to reduce it into a certain area. What we see is that more than 90% of these VLANs are running hybrid, both medical devices and endpoints, and more than 50% of these endpoints are connected to the internet. So it's basically, we have a house, but we left a lot of windows, and some of them are typically open. But to me, this is a key point. 99% of these device-to-device connections that are happening, and once again, specifically with medical device, are not needed and should be blocked. And we can increase our level of protection of any healthcare organization just by doing this simple thing, like better segmentation. And I'll talk about more how to do it and how we can do it in a relatively simple manner. Some statistics that we have, this is from nearly 40 hospitals now. 61% of devices are at cyber risk. 8% remote execution code. 1% very high risk. What are the common things? Default credentials, right? And maybe everyone knows about that, but it is just amazing to see how many devices are still using default credentials that anyone can get off the net. Unpatched software, which I touched before. People using devices for various reasons, not just for their clinical use. And just to share some of the real, real examples from hospitals. Of course, medical devices used to surf the internet. Some of these security systems are thinking that medical devices are maybe Xbox consoles, CTs talking to IP cameras, identifying them as printers. So you can think, two-way communication with a really unsecure IoT device. Medical devices jumping into Wi-Fi, to unsecure Wi-Fi areas. And then, as I mentioned before, a lot of these very old XP, even Windows 2000 systems with antivirus that was not updated, and once again, putting your organization at big risk. So with that said, I'm going to ask Linda again if you can, the next poll question before we jump into our best practices.
Okay, Safi, I have now launched it. The question is, does your organization possess and maintain a full accounting of the connected networked devices? Either yes or no. So we will give it a couple of seconds, Safi, before we close out the poll. More seconds. Okay. Right, I think we've got good numbers now. So I've closed out the poll, and you have 64% said yes, and 36% said no.
So 64% are accounting, they have a good idea of their visibility of their network. And that's good. That's really great. It's probably one of the first things we're going to talk about in the methodology here. And what I'm going to spend in the next 15 minutes with you, maybe 20, I want to leave some time for answers, is to show you what can be done. And this is probably the biggest takeaway from what I want you to take from this webinar today. So there's like 4 steps I'm going to talk about, and then I'm going to put everything together for each one of these steps. So the first one, as I mentioned, and we've talked, and we see that at least 60% believe they have a good handle of this, is the inventory. Okay, what do you have on your network? But not just getting a good picture in time. As I mentioned before, you want to see that devices are being added or taken off, because if you do put a plan based on a current inventory, and that inventory changes, in the next 2 weeks or month, once again, your plan is, no more or not as relevant as it was before, and you could be basically making wrong assumptions. And this is not just for the devices. I mentioned before the segmentation. Like I said, 50% of segmentation done today is done incorrectly and exposed to the network. So devices and segmentation or VLANs. Second is the assessment, and when I say concise risk assessment, there's a couple of things here. The first one is understanding each device's problem, not just a group of devices. And the second one is understanding the context at which this device operates in your system. So which other devices it's communicating with, at what protocols and so on. And based on that, build, what the vulnerabilities and risks are, and do this in a way that, once again, is prioritized. So, and I'll go more deeply into this area, but it's very, very critical. The third one is the detection and prevention. So detection, first of all, you want to have this ongoing look for anomalies and malicious activity. You want to see when something's happening, if a lateral attack is starting, in order to get into the right mode, get the right alerts, get the right people involved. And the second one, which we'll also spend some time on, is taking preventive measures. So being ready before it happens and not after the fact, and doing or taking steps to reduce the total attack surface. And then lastly, using analytics. These systems can show you how people use devices, and I'll show some examples, and use this for various things from maintenance and patching to getting insights on how doctors or the staff use these devices and help you or help us do a better job at protecting them. So let's jump into each one of these areas and just explain a little bit more before we go to the plan. So I mentioned the detection in inventory, and what I mean here is you want to have as widest coverage as you can, because you don't want to leave things out. You cannot protect what you don't know you have. I think it's obvious, but it's a first step. And then the second one is being able to go to the details. So it's not enough, and I've seen a lot of inventories done with groups of devices or families of devices, but not all X-rays or CTs, or especially infusion pumps. What you have hundreds of types of devices. They're not all the same. They're not running the same operating version. They're not, they're not the same models and so on, and therefore are exposed in many cases to different types of vulnerabilities and threats. It's very common for us to find same type of device, 2 or 3 different models that run 3 different application versions. And one of them is, could be very exposed to even a WannaCry, and the others could be okay. So very important to make this distinction, because once again, the program you make has to be prioritized. You can't do everything at the same time. We can't capture everything. We'll have to prioritize and take steps accordingly. Deep visibility. What I mean here is that a lot of these medical devices and IoT, are running behind either a gateway or terminal server, specifically the RS-232 ones, the serial devices, and they appear to the firewall as one IP address. But in reality, there's 5-10 devices behind that terminal server, and most of them, if not all of them, using old protocols that are not built for security or protection. So you need to see these things. You need to know they're there. That might be your weakest link in your whole network. And then, PHI, I know it's once again the biggest discussion point and the biggest priority for, specifically around compliance. You want to know which devices are carrying PHI for compliance and other reasons. And then last thing I want to touch here is that, integration between systems. Security is a teamwork, and that integration allows to create a higher, kind of level of data. So if, a NAC or a CMS or a firewall will exchange information between them or in a system like ours, will have a much richer data for everyone, and the synergies, you'll see them profoundly, and definitely when it comes to the workflow. The risk, here we're talking about creating a good, what we call a risk model, a comprehensive risk model, and it's built from a couple of factors. First, you want to keep up with the latest threats and vulnerabilities. Attacks can happen any day. You want it to be automatic and allow you to basically just make decisions. So you don't want to do all the kind of heavy lifting by yourself. You want to just get the recommendation of what actions you can take. And lastly, as I talk about the comprehensive risk model, it has to take into consideration the types of vulnerabilities, threats, what mitigations are around. So you might have a very big threat, but this device is, sitting behind a firewall, and that's okay. But that's why understanding the context of how these devices operate in your business is very critical, and what impact it could have on your business. Clearly, patient safety, very important, as I mentioned. Compliance, very important also. But many of our customers, this is a big revenue generating devices for them. Whether it's CTs or X-rays. So that has to be taken into consideration. And based on that, we create this, if you want, this map of priority that will be the basis of what I'm going to show in a second of our action plan in mitigating a lot of these risks. The patrolling or detection, I think the key points I want to stress here, first of all, look for a big diversify sources that you can rely on. Okay, so using anything from known, like ICS cert or vendor advisories, and going deep into what's going on the web. So, for example, our team of analysts, they'll because they're mostly attack and defend hackers. They know where hackers go and look for kits to with vulnerabilities in medical devices. So they'll go into their website. They'll search around the dark web and look for these things and try to assess what's the hottest trend, where it's coming from. And then as you've seen before in the little clip we showed you, our research team that basically finds vulnerabilities literally day in and day out. This is what these guys do, both hackers and medical device experts, and together with the bigger vendor community working into bringing these findings out responsibly, so patches and solutions can be found before the hackers can get their hands on it. So this is a whole area. Once again, that's the ongoing thing that once again in the background, but every time something new comes up, you should get alerted on it, whether it's into your SIM system or to other workflow. In the micro-segmentation or prevention, I really like this, and I think it's one of the underused tools that you have in place. In this case, the idea here is to reduce the attack surface, and because every device has a very clear way it operates, it's very clear in this example who should be talking to this device, or what types of communication should be allowed, what type of protocols should be allowed, and what type of communications and protocols should not be allowed. And that's where I went back to this 99% of this, machine-to-machine conversation, should not be allowed. There's very, very few things that could be done. And because we understand, or you guys can understand the context of how these medical devices operate, there's a very effective way that, to create clear policies that with the right semantics can be implemented or enforced through, once again, firewalls, NAC systems, or other systems you have in place, and reduce the attack surface significantly. And then lastly, operational analytics. Once again, an area that we see that is both can be taken advantage of by medical practitioners, including biomed and clinical engineering, as well as IT. And I'll give you maybe 2 or 3 use cases here. So because you can see how devices are being utilized, you can find communications that shouldn't be happening, or misconfigurations the way the devices were set. A more interesting use case is just because you get this heat map like you see here on the right, you know what times this device is being used. So if you're looking to patch or maintain this device, or the vendor wants to know what's the best time to do these things that will not affect normal operations, you can get a very good understanding. You'll see that on Sunday between 4 a.m. in the morning and 6 a.m. these devices are never used, or this specific one. That's a good time to plan for patching. And then lastly, and I've seen this happening more and more, if you look at this interface between old operating system like Windows XP, Office 2000, Windows 2000, so on, what we're seeing is a lot of these devices are hardly used. So sometimes 5%, 7% of the time is their usage level, and that's a good reason to maybe make the case to change them, or to get them out of commission and get new ones. So here we're also starting to incorporate this handshake between biomed, IT, and security, building up a use case for procurement to upgrade or change devices that possess a big risk for the organization. Some of the tools that you have in your toolbox, and once again, this is just very high level, but just to make sure that people know that this is around. So anything from configuration changes, especially when you install a new device, make sure you have the right configuration and make the changes if you need so. I'm not going to mention too much about patching, but definitely something that just try to keep up to date as much as you can. Antivirus, we don't think about a lot about antivirus in medical devices or IoT, but they are all running some kind of an operating system in a lot of them. A lot of the vendors, or whether it's the Microsoft or the software provider, do try to keep up pace with the antivirus. So just make sure it's up to date. And then lastly, as I mentioned before, there is a way now, even if all 3 of these don't work, or you don't have them, or there's no patch coming in for the next couple of months, you can always create this micro segmentation and reduce the attack surface sometimes by 80 or 90%, and really make it hard for the bad guys if they even try to attack you. So let's talk quickly about some kind of what we call an incremental implementation plan. And the reason I'm talking about this, and I'm sure everything is incremental, but you guys have been probably going through some epic or some very large installations that sometimes take years, and what causes in many times what we call this project fatigue, right? So after a year or two, you already forgot what you did in year 1, and things like that. And therefore, we always kind of try to take this crawl, walk, run approach, kind of think big but start small, with something that every step needs to get or to show a very clear ROI, whereas the next steps basically takes advantage of that previous one, and the synergies just grow on and on. And this is not just talk, this is realistic. And I'm also want to kind of mention this because it could be overwhelming. You're kind of saying, well, I get all this list of thousands of devices and vulnerabilities. What do I do? and how do I go about it? And what I'm showing you here is a generic form, but once again, it could be easily tweaked to your organization. So I'll walk quickly through the steps here. Live inventory, as I said before, try to integrate it with other systems, whether it's a CMMS system or a NAC or a firewall. Get the most data you can out of everything you have, and so you can really make the best risk assessment, which is what I've just, is kind of the next step here to the right. Make this risk assessment, make sure it's ongoing, right? Otherwise, you might think that, it's good, but it's good for that point in time, but not good for, a couple of months later. Then from there, put everything into specific devices, but also into groups, and go after the low-hanging fruit. And in this case, every organization knows what they can do fast enough, where is the biggest risk for them, and there might be various ways to to go about it. Some of it relates to insurance, some of it relates to other changes you can make. We know of people just taking things off the network. I don't think it's a good practice, but just take this into consideration, do your own analysis, what's the right thing. And then, start working on, patching, configuration, as I mentioned before. And then, if needed, focused on, try to focus on microsegmentation if you don't have a good solution in place in order to reduce that attack surface. If threats are detected, I'm looking at the left side of this program. If you have a SOC, if you have an MSSP that working with you, make sure the playbooks are, in case of an attack, are up to date, based on the risks and the threats that are there and the mitigation options. And of course, you always want to have a good incident response plan, and of course, you always want to have a good insurance plan for that matter. But like I said, it's all together. It can be all packaged together and done in several steps, and not all at once, each one bringing its ROI. So lastly, some numbers to take away for you guys. Just want to keep that fresh in your mind. IoT is becoming a big part of your network. It's going to grow significantly. There's, at least, I think there's a higher number, but 150 different device families, once again, that operate differently, and with each one, a lot of variances. At least the ones we know about today, a lot of them, or a big portion, more than 60%, are at cyber risk. And then, like I said, there is a way to reduce that significantly just by blocking communication that shouldn't happen. So the takeaway here, automation, let systems basically, or technology, do the discovery, the risk assessment, and microsegmentation for you, and basically keep your very precious resources and time to make decisions and build in a plan and execute. So with that said, I just want to wrap up with a couple of points, and then we'll go into questions. So as I mentioned, MedTech challenges, we have this converging world, AI, it's not going to stop, it's just going to get bigger, and that will increase the vulnerability, due to these, unique attributes I mentioned before. I think we need to put more focus on patient safety. I don't think no one's going to try and use it now to hurt patients deliberately, but with, nation states and really bad people out there, and there are, that might come into, I think it's not a question of if, it's a question of when. We should start thinking about this in this way. I think more action should be taken. And in terms of action, take the right steps, make the assessment in-house based on all the information you can get from the tools, and then use operational analytics for times to take actions and improve your procurement and improve the process into which you bring in new devices into the network. And then take the incremental approach. Think about that. Think big, start small. World is getting more and more digitized. You cannot do everything. You need to prioritize. You need to find what the key things are for your organization and do that first. And then if there's no off-the-shelf solution like a patch, think about mitigating risk with some prevention options. So with that said, I'm going to kind of stop here, and I'll take some of the questions. Thank you.
Thank you, Safi. Yes, we've got a few questions that have come in. The first one is, what's the difference between IoT and IOMT?
Well, as I mentioned before, as I've shown you in the slides, we think of Internet of Medical Things as, something that has direct impact on patients, patient safety, and patient care. Whether it's infrastructure, behind could be the servers, but and make a big difference when it comes to IoT, which is like IP cameras or printers, which are important, but don't possess a direct threat. And also in terms of understanding how these devices operate and communicate with each other and the context of which they work will provide higher results in securing them.
Okay, that's great. And can you explain how micro-segmentation reduces exposure to risk?
It's really simple. It sounds maybe complex, but it's really simple. It's going back to understanding the relationship and the way medical devices operate. So if you know that, for example, an Xray machine should get, I can actually go quickly back to this slide. And so if an Xray machine should be, getting information maybe from the vendor, whoever operates this machine should be communicating to a PACS server or ADT. That's really what this machine does. It doesn't do more than that. It's not a computer that, or an iPhone which has many functions. It has very basic functions, and understanding these functions, you can basically create, a policy for this machine specific or family of machines, and enforce that policy, and in that way really reduce the ability for hackers to gain control or use this machine as a backdoor.
Okay, and how does a solution like this integrate with other security platforms, and how does it integrate with the CMMS?
So most integrations today, especially with new systems, are quite easily. They're done through APIs. Everyone today is using the same language, if you want, and the same connections, and that's I would say it's standard. We always can use other methods like CSV and other ways to push or pull data from each other. But clearly, this is something that is doable. It's really more about the vendors sitting together. Customers will ask their vendors, and vendors will, in 100% of the times, at least that I've seen, will actually sit together and make that integration happen, because the synergies could be so big, as I mentioned before, around data exchange and the richness of data that can help trigger workflows and protect devices much better.
Okay, that's great. We've got time for one more question, Safi. Do you have a tool or template to perform a risk assessment?
A tool? Sorry, can you repeat that? A tool or template?
Or template to perform risk assessment.
We do it once again automatically. It's embedded in the tool, but it's cyber world, you have to be an expert. So if you're in the medical device business, or you're in the healthcare organization, you either have in-house experts that can do that and have the tools to do that, or you once again will have to rely on third parties, whether it's an MSSP or someone that to do it for you. So there's many tools. I've seen many ways to do risk assessments. I'm of course drinking the Kool-Aid of what we do, but I believe you need to just use the widest range of sources of known risks and vulnerabilities. In addition to looking at what's going on in real time on the web and the dark web, and like I said, all of the cyber companies use same tools. Then put all together in a program, if you want, or in a way that makes sense to medical devices, right? Because not all devices are equal. As I mentioned, an IP camera or a medical device or a computer or a cell phone are not the same as an X-ray machine. But you have to put this in the context of the hospital. You have to put it in the context of what's critical to your operations and what's critical to your patients, and based on that, build a risk assessment. So, sorry for the long answer, but it's something that you need that level of expertise to do it well.
Well, that's great, Safi. We're actually coming up to our hour. So, attendees, if you've submitted a question, I will be forwarding them to Safi to answer offline. So please be patient for his answers. Thank you, Safi, again for a great and very informative webinar. And obviously, thank you again to today's sponsors, CyberMDX. One lucky attendee will win an Amazon gift card for completing the post-webinar survey, which will appear on your screen shortly. You must complete the survey to obtain your certificate of attendance. For more information about our upcoming webinars, please visit our website, webinarwednesday.live. Thank you once again for joining us. Enjoy the rest of your day, and we hope to see you next time.
Thank you very much. Have a good afternoon.